1 billion people across the world lack access to healthcare systems. Each day, more than 36,000 people die of preventable deaths. Without addressing poverty and poor health, this cycle of suffering can be broken. Groups of students at universities across the United States are building a movement that not only addresses the challenges and needs of the under-resourced communities around the world, but also making a meaningful impact. Through partnership with such communities, students work closely with local leaders on a development of sustainable health infrastructures. GlobeMed at Loyola University works directly with its partner community, La Primavera del Ixcan of Guatemala, on development of their health project. During their 2009 on-site trip, GlobeMed spent 1 month working with community leaders and health promoters on problems the community faced. And one of the things they focused on was training health promoters on basic medical responsiveness.
We had class pretty much every day for about 2-3 hours, and then we had practicum. So we teach a lesson prepared by the students, and they spend maybe an hour and a half of lecture time with the promoters. And then we would go practice our skills afterwards for a couple hours.
Porque vomitando.
Vomitando. Ahora voy a hacer así. Ya.
Sí.
A lot of people here who really want to learn a lot, and we're able to teach them a little bit here, and they're going to be able to teach each other, and they can start using a lot of this stuff in their clinic. We're working on blood pressure, we're working on taking temperature, the basic stuff that you do at the beginning of an appointment in a clinic, just taking down basic data.
Every night, medical professionals would guide GlobeMed staff in study of different health topics before they would interact with local health promoters next day. Relying on where there is no doctor manual for their instruction was a safe and comprehensible call. This manual helps people without access to health infrastructure in dealing with health challenges they face. The purpose of students leading lectures and hands-on trainings was to show local health promoters how they can work together in GlobeMed's absence and engage in self-education and training. GlobeMeders also showed how more experienced health promoters could train those with less experience using very same resources.
So we would educate them how to do it, and then they'd watch us do it, and then we would make them do the example for their other promoter friends. So, for example, we taught them CPR. So we showed them how to do the CPR, and then they had them practice on themselves, and then they taught each other in like a lecture format, interactive, like practicum. We taught them the same with like suturing and casting and splinting and oral rehydration therapies and such.
Besides medical training, GlobeMeders focused on preventive education geared towards children, with the goal of improving overall hygiene and sanitation of the community in the long run.
So we had health sessions that we called charlas, which are basically health chats with the promoters of La Primavera. We thought that just as important as treatment was, we thought it was just as important to teach them about prevention. And that's a little bit what the charlas bring to the table. We educate them about hygiene, sanitation, purification of water, how they store their water, and these sorts of methods have been proven to be very, very effective in communities like this.
They know pretty much all this information, but it's to help them use things like posters and activities to explain health and sanitation and the importance of clean water to their kids and to the students and to the people in the community. And the reason why we do it to the kids is because the kids have a tendency to go off and teach their parents. Because sometimes when you teach parents things, they don't really listen. It's like you can't teach an old dog new tricks. Sometimes it's the same way with a lot of the parents in the community. Once they've been doing something regularly, so often, they won't change. But then the kids, they might start to change. And that's where it can become really, really effective. And we also want the promoters, their faces, to be really well known. So the kids, when they come into the Centro de Salud, they won't be scared. So they've seen their faces before, they know that they're friends, they kind of teach them, they know that they have knowledge about health and safety and sanitation.
The purpose of our on-site visit was mostly to kind of sit down with the community leaders in a face-to-face environment where we could create a structured project and create a formal partnership with the community where we're all on the same page and we all understand what our project is going to be and how we're going to move on from there.